Good morning, everyone. We are the Group 2 and we'll be presenting the data, information, and knowledge. For my members, first, Ms. Ilarmo Mariel, Batallones Kyla L., Mallorca Maria Frances Kyle, Salmarine Rage of Faith, and yours truly, Garcia Sheena Rosa. For the introduction, data can be processed to produce information. Data and information are the building blocks for creating knowledge. But the practice of nursing, and in turn the practice of nursing informatics, occurs when data, information, and knowledge are used to meet the health needs of individuals, families, groups, and communities.
So the roles of ICT in nursing. With the advent of computer technology used in nursing, the need for data to be analyzed and interpreted to become usable information in practice escalates with each passing year. In order to work with data, process information, and derive knowledge, nurses must be able to apply nursing informatics to their practice. Information communication technology facilitates high-quality learning experience for providing tools effectively and economically. Also, ICT understood as a means for a quick and easy access to information, facilitating the learning process and contributing to decisions in nursing care based upon scientific evidence. ICT is also essential in the communication between nurse and patient and between health professionals, promoting the continuity of care and support people with chronic diseases. Also facilitates in the research and communication not only in academic contexts, such as theoretical and practical classes, but also in health units contexts. ICT increase patient safety by having the ability to save all of a patient's information in one place, including lab results, medical imaging, and more. Also helps to minimize costly errors that occur when all relevant information is not available during decision making. Next is efficient care coordination. Multiple medical personnel participating in the patient's care can use information technology systems to record, disseminate, and share updates, logs, and discoveries. This cross-disciplinary information sharing has increased patient satisfaction while also assisting in the coordination of care and case management, resulting in a more seamless experience for both caregivers and patients. Next is effective use of up-to-date information. For these activities, effective nursing management relies on the effective use of up-to-date information about patient flow and acuity, staffing, and costs. Thus, evaluation of these systems should be conducted to manage cost, activity planning, resource allocation, and quality assurance. Next is reduce redundancy in tests and procedure. Electronic health records makes it easier to share patient information by lowering discomfort, difficulty, medical costs, and dangers by removing redundant tests and procedures. Patients can use this technology to allow immediate access to timely and relevant information that the health providers require. Next is decrease human error. Human mistakes can be reduced using new technologies. Nurses who work long shifts or work in understaffed units are more likely to make mistakes. Routine operations have been simplified thanks to improved medical technologies. Automated IV pumps, for example, can measure the dosage of medication administered to patients. This makes altering drip amounts and dosages a lot easier. Electronic health records also aid in the reduction of errors at the bedside. It also assists in eliminating duplication of testing and treatment delays because the data is easily available. So the last is positive impact on nursing shortage. Nurse burnout has contributed to the nursing shortage. Long-term mental and physical exhaustion can make nurses feel overworked, causing them to leave their practice setting. Emerging telehealth technology can help relieve the strain on nurses by requiring fewer nurses to deliver effective care. Nurses can also use telehealth to reach out to places where health professionals are in short supply. It also assists to alleviate the shortages by successfully providing care to patients remotely. So these advancements in technology have the potential to save healthcare expenditures by reducing the number of ER visits and hospital admissions.
So next, we have data versus information. So let us discuss first the data. So data is raw, unorganized facts that need to be processed. Data can be something simple and seemingly random and useless until it's organized. So data comes from the singular Latin word datum, which means something is given. So over time, data has become the plural of datum. Next, we have information. When data is processed, organized, structured, or presented in a given context so as it to make it useful, it is called information. So information is an older word that dates back from Old French and Middle English origins. So it has always referred to the act of information. Usually it regards to education, instruction, or other knowledge communication. So again, data is independent of the information, while information is dependent on data. So for conclusion, data are simply facts or figures, bits of information, but not information itself. When data are processed, interpreted, organized, structured, or presented so as to make them meaningful or useful, they already called information. So again, information provides context for data.
So, what data, information, and knowledge is in relation to nursing care? We'll be presenting a short video for you to understand the relationship of data, information, and knowledge in nursing.
Welcome back to another blended learning. If you're watching this video, you've reviewed the PowerPoint slides and read the assigned chapters. This video will model the process of operationalizing detailed information in your upcoming project. Also, give careful consideration to tables 2.1 and table 2.2. Table 2.1 causes of poor health can support your stomach with the problem of addressed. The activities for improving data quality, table 2.3, support your possible solutions section. Let's go ahead and get started. Please open your textbook to page 50. We're going to talk a little bit about data versus information. And then I went ahead and redrew the figure 2.1 and put it into a more conceptual map. You can think of it as starting in data, then going to information, and then finally ending up in knowledge. Think of that as a process, a circular process, in this case, or the way I drew it. Let's use public health as an example, and we'll use a definition from Carroll's textbook on public health information systems. And he describes it as a systematic application of information and computer science and technology to public health practice, research, and learning. If we drill down, what is driving the change? Why do health professionals need to be knowledgeable about computerized health information systems? One of the drivers is the reform. Think about the Affordable Care Act. Another is growth in managed care. And then finally, health information revolution. Think about electronic records, electronic health records. The terms data, information, and knowledge are often misused in discussions about healthcare information systems. Therefore, it's important that you understand and have a grasp of the precise meanings of these terms to be an effective manager. All right, let's get you a formal definition of data. Data is a measurement or characteristic of the person or thing that is the focus of an information system. So let's get an example using public health. A public health assessor records the levels of toxins at various locations at a waste site. Information, data placed in context within an analysis. Going back to our example, the public health assessor creates a table showing the proportion of locations exceeding the appropriate maximum contamination level at the waste site. Knowledge, the application of information by the use of rules. Our public health assessor consults the action levels for the contamination based upon a journal entry or a publication by a lead authority like the CDC, and then makes a remediation plan accordingly. Let's try another example. A health organization records the number of HIV infections in the largest cities in South Carolina. That's the data. Information, data placed in context with the analysis. The health organization tabulates the positives at the various HIV clinics throughout the state. Along with the information from the HIV clinics, the researchers also tabulate the HIV cases at the area hospitals in the largest cities in South Carolina. Finally, the researchers take the information from the rehab facilities for intravenous drug users where they've reported cases of HIV in these cities. Knowledge, the application of information by the use of rules. So they take in the three data sets that they have for the information that they're tallying and they've been tabulating. They then go and do a literature review. They look for benchmarks or precedents that were set based upon journal articles, and then from there take that knowledge, create a course of action or a remediation plan.
For data, data could play a huge role in gaining insight into the value of data, giving meaning to information that will integrate nursing science, informatics, and analysis, such as individual status in terms of weight without other data elements like height, age, and other data from different tests, it would impossible to interpret the significance of the result from the patient's well-being, and thus the data is crucial. So for example, in the nursing care, we usually take data or collect data during assessment and history taking. So there are two types of data in nursing history, objective and subjective data. For objective data, these are measurable kind of data and in numerical numbers, while subjective data are from the experiences and verbalizations of the patients. Next is information. Information supports decision making and assists nurses in daily interventions for efficient and effective care. Information is the key to support the whole system approach to have safe sharing relevant data that can lead to improve the health planning and better access to nursing care. So in this part, a group of data elements that have been organized and processed so that one can interpret the significance of the data. For example, height, weight, age, and gender are data elements that can be used to calculate the BMI of the patient. So the BMI can be used to determine if the individual is underweight, overweight, normal weight, or obese. So in this part, for information, you can analyze the data and diagnose the patient based on the collected data and the assessment and history taking. For the knowledge, knowledge forms relationships and interrelationships between data and information. Knowledge is what we know. It is an accumulation of past experience and insight by which we interpret and assign meaning to information. For example, the knowledge base may include patient's condition and information. So, example in clinical setting, a fever or elevated temperature. At the beginning of the chill, the patient's temperature may be normal or even subnormal. But in 30 minutes, it is likely the patient will have an increase in temperature. So a rule might be possible. So if a patient complains of a chill, then take the patient's temperature and repeat in 30 minutes. An application in nursing care, after you have collected the data, analyze the information, you could plan for the intervention for the treatment of the patient's condition.
So next, we will describe the relationship between data, information, and knowledge. So first, we'll present you this video.
In this video, we're going to look at the different levels of knowing and understanding. In everyday language, knowledge is a word that means different things to different people. Some people regard it synonymously with information, while others see it as something more. In the online Oxford Dictionary, it is defined as facts, information, and skills acquired through experience or education, the theoretical or practical understanding of a subject. In other words, it covers just about anything. However, in business and in other disciplines, we tend to differentiate more concretely between data, information, and knowledge. Let's start with data. Data is the lowest form and refers to unstructured facts and figures which lack any kind of organization. The next level is information. Information refers to data that has been organized, condensed, contextualized, and so on. The data now has a direction and a purpose. For example, data is generated when a product is manufactured and marketed. There'll be lots of numbers and facts regarding costs, pricing, income, market research, and so on. This data becomes information once it actually conveys something specific. For example, once it answers the question, what was our profit last quarter? Or which of these two products performs better? Or which facility was most cost effective? Knowledge, on the other hand, represents a deeper level of understanding and know-how. It is very much based on experience and rooted in context. Davenport and Prusak defined it as a fluid mix of framed experience, values, contextual information, expert insight, and grounded intuition that provides an environment and framework for evaluating and incorporating new experiences and information. Examples of knowledge could be how to fix a machine, how to organize a project, how to market a product, the wisdom embedded in a procedure, even if the person does not know what it is, and so on. You'll also notice that knowledge can come in substantially varying degrees. For instance, you may have someone who's good at marketing, or you may have someone who's a true marketing whiz. You may have a newly graduated IT support, highly experienced professional whose years of work provide invaluable insight and intuition into solving problems. In a later video, I'll look more specifically at the types of knowledge and what they imply to knowledge management. So, to recap, data refers to unstructured facts and figures. Information refers to structured, organized, and/or condensed data, while knowledge refers to a deeper level of understanding and know-how. Thank you for watching. If you haven't done so already, don't forget in this video, we're gonna...
Okay, so again, what is the relationship between data, information, and knowledge? So first, data is referred to as an interpreted item, often referred to as data elements, facts and figures which relay something specific, but which are not organized in any way and which provide no further information regarding patterns and context. It is often called as meaningless. Next is information. It is a collection of organized and processed data that can be given significance and meaning. For data to become information, it must be contextualized, categorized, calculated, and condensed. So it answers questions like who, what, where, and when. And lastly, knowledge. It is mainly built from the process of converting data to information and understanding the meaning of that information. It is closely linked to doing and implies know how and understanding. So both data and information are objective in nature and only provides context, while knowledge can be gained from combining context and experience through working, studying, or life in general. So basically, data, knowledge, and information is a continuous process.
Data is one of the basic elements needed to start this process, collected through different means, including surveys and interviews, and used as a basis for making calculations or drawing conclusions. Some examples are the colors red, green, and yellow. For these colors to have significance, it must be converted to information. Information is the second step in the process. The data collected are then given meaning and organized. The colors generated from data are given meaning and significance. Red light means stop, green light means go, and yellow light means caution and be prepared to make a full stop. The data was interpreted, resulted in information. As information is already established, an individual can therefore develop knowledge from it. Knowledge is a higher concept. The information that was generated is therefore analyzed and understood. It is a formalization of the relationship of data and information. It was revealed earlier that traffic lights have three colors. Then it was given meaning: red for stop, green for go, and yellow for caution. Knowledge is then generated to stop the vehicle when you are driving, when you need to stop braking, and where you need to. It was said earlier that data and information are objective. Knowledge, on the other hand, is subjective, and given meaning for a specific purpose. As data is transformed into information and information into knowledge, each level increases in complexity and requires greater application of human intellect.
So as we end our presentation, we will leave you this quote from John Naisbitt to think about as we continue to live in this world run by the advancement of technology. Previous slide, please. We are drowning in information, but starved for knowledge. And as stated by Rosemary Ventura, a lot of nurses don't know that nursing informatics exists, so we can do a better job of bringing awareness to the nursing community. And that will be all for our report. Thank you.